Hello viewers, I'm Dr. Revati Ramaswamy from Apollo Hospital, Secunderabad. You all know what hysterectomy or removal of the uterus is. Let me talk of the various ways. How do you remove the uterus? There are so many modes of uterus removal. If the uterus has, come down and become loose and is coming out from below, then the right removal is from below and it is called as a vaginal hysterectomy. This is one of the most patient-friendly approaches for uterus removal. Along with removal of the uterus, whatever the neighboring structures which have become loose are tightened. It is called as supporting the pelvic floor and the perineum so that the entire area is upholstered. The other approach is laparoscopic hysterectomy, which is removing the uterus from the abdomen using very fine cuts, which is about 0.5 to 1 centimeter. Then, if the uterus is too large and if the laparoscopic hysterectomy is considered not possible, then the traditional approach which is being done for years is called as an open hysterectomy or a laparotomy hysterectomy, wherein you cut open the abdominal wall layers and take out the uterus with our hand. Of course, there is a more recent technique to hysterectomy called as robotic hysterectomy, wherein the robot assists the surgeon in removing the uterus. Each of these modes have got their importance, and each of them are the best in certain situations. So what decides which hysterectomy to do? It is the type of the uterus, the type of the problem, the skill of the surgeon. We need to combine all this and decide on what is the right approach for it. I wouldn't say that one approach is superior to the other. Each are distinct. Like you have a role for a pressure cooker. You have a role for cooking on a kadai. You have a role of a microwave oven. You have a role of a rice cooker. You need to use each of them judiciously. The same way, different modes are there, and we should utilize each of these modes in the right way. Thank you, friends.